Hello and good evening. Welcome tonight to this evening's Help Choose Home educational webinar series. This particular webinar series is co-presented by the Private Duty Home Care Association of America and Caring.com. And our topic tonight is a basic primer on in-home care. My name is Marilee Orsini, and I just have to say how happy we are that you have joined us tonight. I'm serving as the Chief Strategic Officer for the Private Duty Home Care Association of America, which is an affiliate of the National Association of Home Care. And I'll be one of your guides tonight as we start this first of our Help Choose Home educational webinars. To begin with, let me just do a little housekeeping. You are all on mute mode. We do have a lot of attendees tonight, and if we keep you on a mute mode, then that will allow us to have everyone enjoy the series uninterrupted. You do, however, have the option to ask questions. If you'll look on your computer screen on the right-hand side, you can actually ask a question, and we do have people monitoring, and so we will get to your questions at the end. If we do not answer your questions during the webinar, and if we do not get to them during the question and answer session at the end, we will do our very best to try to respond to everyone so that you can get your questions answered. This webinar is being recorded, and the actual recording will be up probably tomorrow on our helpchoosehome.com website. So you can go there. If someone that you know would like to attend the webinar and wasn't able to attend tonight, please send them to helpchoosehome.com, and you can listen to it again there. These monthly discussions that we're having hopefully will help you understand home care and some of the issues that have to do with aging and frailty and planning for long-term care. The Private Duty Home Care Association, as I said, we call it PDHCA, and it was established by the National Association for Home Care and Hospice to operate as an affiliate association, and this is home care providers that are dedicated to providing a full array of home care services, and that includes non-medical services and supportive services to the aged, to the infirm, or to the disabled clients to help them maintain safety and independence at home, wherever home does happen to be. And we exist to help home care agencies, the PDHCA does. We advocate on behalf of home care agencies, and we also advocate on behalf of those who wish to age or recuperate in the comforts of their own home. We provide valuable information and education about benefits of receiving in-home care, and if you'd like more information, please feel free to visit the Private Duty website, which is www.pdhca.org, or about this specific webinar series, www.helpchoosehome.com. Our partner for tonight's discussion is Caring.com, and Caring.com is the leading online destination for caregivers seeking information and support as they care for aging parents, spouses, and other loved ones. Caring.com offers helpful content, advice from leading experts, a supportive community of caregivers, and a comprehensive senior living directory. We are really lucky tonight to have with us Mary Kofund. She is a Caring.com expert, and she's president of Accountable Aging Care Management. That's an elder care consulting firm that works with elder clients and their families to find the best care providers and services to meet their needs. And I think you will be very pleased tonight with the wealth of expertise and experience that Mary will bring you to answer some of these questions. Our objectives, and hopefully at the end of this presentation, you, our attendees, will be able to identify the various models of home care, match the needs of one who needs that care with the appropriate model, and understand some options for paying for care. Now, I don't think I have to tell you that there really is a trend towards in-home care that is growing rapidly here in the United States. Actually, it's growing rapidly in many of the developed countries in the world. And the increase in home health care and non-medical home care services is quickly taking the place of some of the more traditional care options, such as nursing homes. Understanding where to go for appropriate help is really difficult without information, and information that comes from a very, very good source. So hopefully tonight we will answer some of those questions. And Mary, I'm going to start out with asking you, for someone who is frail or infirm, what are their choices?
Well, I think the choices are limited for anyone who has a care need. So they're staying in one's own home with care, so you can have family or friends help, or you can hire help, or clearly you can move elsewhere, and that could be into a family or friend's home, a nursing home, an assisted living or a continuing care situation, or move elsewhere with some one-on-one care. I think the choices really are very personal. They're based on finances, medical needs, and personal preferences. So although they're not a plethora of choices, there are choices, and one needs to know what those choices are and exercise those options.
And one of those choices, obviously, is home care. So what is the intrinsic value in choosing in-home care?
Well, I think for most of us, we kind of feel like right away that being in our own home kind of is where everybody would like to be. If you get asked, certainly I think most people feel very comfortable like their home is their kingdom. So home care itself can reinforce and supplement the support of family and friends. It also can help a person maintain their dignity and independence in what we might consider to be the least restrictive environment. And there have been many studies which say the process of healing occurs better in a familiar setting. I think you already said something earlier, Mary Lee, that I want to emphasize, and home can have many definitions. Home can truly be the house that I lived in with my husband for 30 or 40 years and am still living in. It might be, in fact, an assisted living or an independent living that is what that apartment I consider to be my home. It could be that I moved into a home with make my home now with my son or daughter, and that room and that part of that house is now my home. So home care can mean many different things.
And I'm assuming that there are some people who are better candidates for home care than others?
You know, I'm not sure that there really are. There are a lot of issues that one could look at in looking at home care as an option. I think obviously we already said briefly that finances and personal preferences can make a big difference in whether a person is a candidate for home care. But I think the thing to look at is the person experiencing some trouble performing basic activities of daily living? In my line of work as a care manager, I've seen a lot of opportunities to recommend to families home care, and I'd like tonight to share with the folks listening to the webinar some of my stories. And one example would be looking at a person who was having trouble performing basic activities of daily living. I'm going to call her Elizabeth, and Elizabeth lived in her own home where she had lived with her husband. She was now a widow of several years, and she was beginning to experience some dementia. And what her family noticed was that she wasn't keeping her house as neatly as she had. There was some concerns about proper meals and, you know, cooking, as you can imagine, for just yourself when you get to be in your 80s is not always, and eating by yourself isn't always all that much fun. And she was kind of a little sloppy about taking her medications. And so having someone come in and assist with those things made Elizabeth an outstanding candidate for home care. Another person would be someone who has no family available or needs socialization, transportation, or companionship. And no family available can mean a lot of different things. This lady I'm going to talk about's name was Mary. And Mary moved to be with her son and daughter. And the daughter worked and the son worked, so it left Mary in a strange city in a house where there was no one. So technically there was no family available, and she greatly needed socialization, transportation, and companionship. So I recommended to that family that something be arranged for Mary that she could have a couple of outings twice a week with a home care companion. And it transformed her life. Listed on the screen now are some activities of daily living, and these are just the things that a person might have trouble with. So they're there to serve kind of as a trigger for those of you who are watching the webinar to take a look at some of the things that a person might have difficulty with. That lady Elizabeth that I described, for example, didn't have trouble bathing, but it was felt that it was much safer that there be somebody in the house when she took her bath. So it could be help with dressing, or transferring, as we say, walking, eating. Eating can also mean cooking, toilet use, grooming, things like that. There are also instrumental activities of daily living, and those are another place that I think those of you who are listening to this could look and see maybe these are some activities that your loved one might need help with. For example, using the telephone, traveling, whether it be in a car, by public transportation, shopping, meal preparation, housework, medication use, and management of money. The last two items on the list of instrumental activities of daily living, medication use, and management of money, there are some distinctions in home care, and not all home care agencies can assist with those two items.
Mary, I just was alerted that we had a bit of a technical problem right in the beginning, and so before I go to the next slide, I'm just going to go back to the beginning.
Okay.
And just show a couple of things. So we will have the slides actually recorded for the webinar for tomorrow. So
okay.
For those of you that didn't get the visuals, then you can see these are our presenters, and I went over the objectives for tonight, and I talked just a little bit about the trends, and then Mary started talking about some of the choices for those people in home care and the intrinsic values in choosing home care and the candidates for choosing home care, and then we came up to our activities of daily living and the instrumental activities of daily living. And the next thing, Mary, we're going to talk about is, does the government pay for home care?
That is such a, I guess I shall say, loaded question in one sense. We didn't talk about it in my background, but I worked for the Social Security Administration for years and also worked for the Medicaid account in Texas. And so I'm very clear about what government pays for in home care and what it doesn't. But I think that many family members are not aware of what happens. And so let's talk about Medicare first. Medicare is really a health insurance, and that's what I think people need to be aware of. It does not pay for what one might call custodial care or long-term care. So it does provide, particularly under the home health care benefit, an intermittent skilled nursing services, and also frequently there is a home health aide. So an example in which Medicare might provide some home care would be, let's say a person had pneumonia, went into the hospital, came home, and was still fairly weak. So they needed somebody to still check on their breathing and might need to have someone come in and assist with bathing and things like that, making sure medications were there, that kind of thing. But it's a very short-term service. So once the person was kind of back on their feet, Medicare is out of the picture. And it's not like a set 3 hours a day or 4 hours a day. You don't get to choose. Medicare's health care rules decide how much care you get. And as it does say here, there's specific eligibility requirements, and it certainly is not intended to cover ongoing care.
Well, a lot of people get Medicare and Medicaid mixed up. Can you talk just a minute about what Medicaid covers?
Medicaid is a program primarily for people who have very low income and very low assets. So as the slide says, it's really meant to help the poorest of the poor. Medicaid does have, through its home and community-based waiver program, some in-home care services. And I think the easiest way to kind of describe it is to talk about a set of circumstances. A person was 58 years old, they had a stroke, and they had not been working recently, so they didn't get Social Security disability benefits. The assets they had were needed to take care of hospital costs and skilled nursing costs for their rehabilitation. When they were finally able to go home, and still not in terrific medical shape, the Medicaid program was able to provide them with a caregiver to come in for roughly 25 hours a week. So that gave them roughly 4 hours a day of services. So the person was able to come there, prepare a meal for the person, run some errands for the person, and make sure that they got a bath. But like I said, it was limited to 25 hours. And that limit is solely decided by the Medicaid program, medical necessity, funding for that program, etc. So again, it's not something it is great for when there is no other resource, but it's not something that one just generally gets to choose to have.
Now, you've gone over Medicare and you've gone over Medicaid. What are some other options for home care?
Well, I think the model that we find most often, and one that I think that I would like to spend a lot of time talking about today, is this model called private duty or private pay. And there are several options in that, and we're going to spend some more time talking about it. But the options to pay for this kind of care is generally families finance the in-home care for themselves or their loved one. Sometimes the senior can pay for it themselves or the disabled person, and sometimes their family pays for it. Long-term care insurance, which is becoming more and more one of the options, policies that have been written in the last, let's say, 20 years, have both home care provision so that you can get services at home, as well as payments for sometimes assisted living and nursing home. There's a veterans benefit program that is getting lots more attention, and it's called Aid and Attendance. And it is, again, for a person whose income and assets are not very great, but they don't have to be nearly as low as Medicaid. And the person has to be needing services or spending money on services beyond what their income is. And I know that might sound a little strange, but what that means is that you're dipping into your assets, so you need help from this veterans program in order to continue to have those kinds of home care services. Reverse mortgages and life insurance settlements are two other options, and they're much more complex. A reverse mortgage means that, in effect, you are giving your mortgage to, or giving the ownership of your house, shall we say, to somebody else. So they then, in fact, are paying you to live in your own home, so you can use that money to pay for home care. And a viatical or life insurance settlement is where you would actually sell your life insurance and get a percentage of the proceeds to use for your current care. So obviously lots of options. I think the simplest one obviously is for people to be able to pay either through the long-term care insurance or to finance it themselves.
And in addition to different options to pay for care, there's also different types of home care. So do you want to cover the options for the care that if someone does have the money to pay for it privately, or does have long-term care insurance, or has gotten a reverse mortgage, then how does
certainly, and I think the most obvious one really is an agency which employs caregivers. And I think as this whole, as the aging of America is happening, I think we're seeing in ads on television and other places, certainly on the internet, a lot of information about agencies which provide caregivers. So you'd actually contract with the agency and they would provide somebody to provide the services. There are also registries, and we've listed on here a nurse registry, but there also can be caregiver registries. I noticed that's becoming popular. And it's more just like a listing of people who want to do this line of work. And some basic requirements may have been obtained on these people that are on the listing, but the details and some of the additional background checks may or may not. So you need to look at the registry and see how much information has been checked out on the person. Obviously, people can just hire someone privately, and I live in a university town, and lots of times you'll see ads for university students to come and, for example, spend maybe from 4 to 8 in an evening with somebody to help them do kinds of things. So people can be hired privately, and then help can be obviously obtained from family or friends, neighbors.
And who should use private duty home care or private pay home care?
Well, this is probably the part of the conversation that I think is the most interesting and exciting, to be honest. I think, first of all, the people who do this are people who have a high regard for quality of life issues. When I was telling you about Mary, who had moved in earlier with her son-in-law and daughter, why they hired someone to take her out on outings was to provide quality of life for her. She, like I said, had left her hometown to move in with family that she loved, but there she was for somewhere between 8 and 10 hours a day without much purpose in life. And having somebody who could come be a companion to her, they could go out to eat someplace, she could have some level of independence, that really mattered to her. We also see people use private duty home care to supplement the support of family and friends. And I think this is also really important. We worked with a gentleman named Dick whose family was, some of his family was here in town, some of his family was out of town, and they loved coming to see him at least 2 or 3 times a week. But what he didn't want them to do was to go to the grocery store for him. He loved having fresh flowers. He loved going to the bookstore. He wanted somebody who could be a companion and a transportation service for him so that when his children came to visit, he really could just spend quality of life time with them. Another person who might use private duty home care is somebody who wants independence. Chronic illnesses, dementia, all cause a person to lose much of their independence. They might not be able to drive anymore. They may not be able to participate in activities like bridge or Tai Chi or exercise programs, any number of kinds of things that they did when they were well and able. Maybe they can't garden anymore in the way they would have liked to. But if a private duty person is hired to assist them, then they can do many of those same things that they were able to do before. Also, independence, and kind of the next one is a little like the other side of the hand of it. It's those who don't want to be dependent on others. So we see folks who, again, want to be able to take care of as many of their own needs as possible and not depend either on family or friends or neighbors for the activities. So they want to be able to get someone else to assist with those things. And then, of course, there are those with financial resources to make choices. And these people don't have to be, just as you mentioned earlier, Marilee, elderly. They may really be people with disabling conditions in their 40s, 50s, and 60s who need this kind of assistance. I think facilities are a wonderful choice, but one of the things I want to say about private duty home care is it provides a person a one-on-one companion. It's a level of care that even in the best facility you're not able to get. So if a facility is your home, such as an assisted living or an independent living, or even some cases a nursing home, sometimes having a private duty home care person come in affords a person a level of one-on-one care they wouldn't have otherwise.
Now, I know that we covered this in the slide, a couple of slides earlier, but there are differences for people who need home care, and there are reasons why some of those people might choose one model over another. So, and this is one of the complicating factors that most people seem to find when they're trying to hire someone, because they're trying to compare apples to apples, and sometimes there isn't that comparison. So can you go a little further into talking about models of home care and what kind of person might use which one and what would be best for them?
A full-service agency, and there are many of those out there, they actually employ the caregivers. They've done all of the background screening. They monitor and supervise the care. By that I mean they will meet with you if you're wanting to hire a caregiver for your mother, Mary. They will meet with you and actually ascertain with you and your mother the proper hours that would work for your family, the kind of person that would be a good companion for your mother. They would come and bring that person and introduce the caregiver to your mother, and they would monitor and supervise that care. So if for some reason, for example, the first person or the second person chosen wasn't exactly ideal, there were some issues there, then you contact the agency and changes can be made. Their caregivers are truly employees, so they take care of all of the tax issues and produce W-2s for their employees and take care of all of that part of business for you as well. The nurse registry or healthcare registry is, again, what they've done is it's kind of serving as a broker, shall we say. People come to these registers who want to do this kind of work, and then some basic screening is frequently done. They can, some of them, match the client and the caregiver, but once that's done, they don't employ them, they don't train them, they don't monitor them, and a big difference would be really then the supervision of that caregiver falls to the family member or the senior themselves. So with a full-service agency, as you see, they're going to continue to stay in the picture. They're going to make sure the person is there promptly. If for some reason somebody has car trouble or a sick child and can't get there, they'll make sure a backup person is sent, etc. That's not going to happen with a registry. So if you want something where it's completely taken care of, then that's great. You want a full-service agency. If you want to manage it, if you want to employ the people and train them and supervise them yourself, then going to a registry is a much better choice. And then a different place is still a private hire, and that's where you might go to one of the many internet listings. You might, like as I said earlier, advertise at a local university. You might know someone that is at your church that would be a good person. There's lots of different options, but that means that you do all of the screening, managing, paying, training, anything that's going to be done, you're going to be responsible for doing it. So I hope that kind of answers questions and gets some distinctions for people. Obviously, and not, sometimes people I think get also confused merely a little bit, because sometimes an agency may or may not, in some cases, cost more because you are paying them some premium for doing that management piece.
Now, you've talked about the different types of care, and you've talked about activities of daily living, and you've talked about instrumental activities of daily living. I want you now to talk about the types of services that people can get. What kinds of services can you get at home through home care?
Well, and I think getting an understanding of this is really important, because it is sometimes related to the cost. The costs may be different, and certainly the expectations are different. So, and in many states they are licensed differently based on these different levels of care. So a homemaker or a companion is truly someone who is non-medical. Kinds of things they might do would be, as I described, one of those clients earlier was meal preparation and transportation and errands. They're really meant to be, as that describes, somebody who might cook a light meal, that kind of thing, but their goal really is at a level of kind of buddy, but making sure some things happen. The next level would be personal care services, and my easiest way of kind of describing that is with a homemaker or a companion, generally touch is not essential. In personal care services, touch is essential. So they're involved in touching for bathing or dressing, helping the person walk, encouraging medication, the person monitoring their medication, or having the person, in fact, follow their medication regime. So those things are at a little bit higher level, and sometimes the folks have had considerably more training to do personal care services. And then the next level is skilled nursing. And skilled nursing is largely what it says. Sometimes a person has to have someone in the house who really can deal with nursing-related issues. For example, there may be therapies of a certain kind of thing that needs to be done. There may be wound care. There might be ostomy management, catheter care, those kinds of things. And then you need a person who has skilled nursing and those particular traits. And the thing that when you're, as a consumer looking at getting care for some family member, you want to be asking and having these distinctions when you're learning what services an organization provides, or again, looking at the registries. You want to look at those things differently. And in many cases, as I said earlier, the state licensure is different for these levels of care.
And I just had a comment. One of our participants did say, and this is true, and we should mention this because as the different levels of care vary from state, some state licensure, and particularly in Florida, does allow for the nurse registries and the healthcare registries to do some monitoring and supervision. And but it's in very few states. But I did want to say that because I didn't want our listeners to think that we didn't know that, because but for most of the states that it's the IRS ruling that does limit that the nurse registry, but in Florida you do have that option. So I'll make that correction on the fly here. Now let's talk more about typical home care services. When people start needing home care, what are the types of things that they need?
Well, I think the slide lists a lot of them, and that those things are like meal preparation. And particularly, let's just take the more typical kind of aging issues. You know, like I said before, it's not much fun to prepare a meal for yourself at a certain stage if you've been preparing meals forever, or to eat alone. So meal preparation can make quality of life as well as take care of nutritional and hydration needs, so that's really important. Grocery shopping, so in order to have meal preparation, or for the senior or disabled person to be able to handle meals when someone is not there, having that grocery shopping. Housekeeping, and I want to point out here, just in general, this is light housekeeping. This is not, you don't hire a homemaker companion to do what a traditional housekeeper or house cleaner might do. These are really more like helping someone make their bed, keeping their kitchen clean, loading the dishwasher, those kinds of things, and some light laundry, that kind of thing. Transportation, many homemaker services, and I think this is one of the greatest gifts, is to provide transportation, and that transportation can either be, again, depending on the licensure, etc., can be either in the client's car or in the caregiver homemaker's car. Errands of all kinds, taking a person to a doctor's visit, to visit friends, to go to a bridge club, all of those kinds of things. So there are any number of I think, activities that a homemaker or companion can participate in. We have a client who had a very tragic accident, and she's in her late 40s, and she has brain damage, but she is still physically very able and has some mental attributes as well. And her companion, for example, because she is a younger woman, takes her to have coffee on a regular basis. They go to a gym to work out. They do any number of kinds of things that, again, maybe a little clothes shopping, things like that, things that a more typical 45 to 50-year-old would do as opposed to an 80-year-old. So the activities can very much vary depending on the person's need.
And I know this does vary state by state, but pretty much, can you talk about personal care services?
And it does vary by state, and I can talk quite a bit about it. I think the thing is, it's that hands-on support that we talked about with activities of daily living. So medication assist with self-administered meds. This is such an important part, I think, of personal care, because we see so many folks who just, their medication regime is very important, whether it be somebody who has diabetes or high blood pressure or even dementia. It's really important that they be reminded to take their meds and that they take them at a very specific time. So this is a very significant part, I think, of personal care services. Certainly bathing, grooming, reminders and help with everything from brushing your teeth to skin care, help with walking, help with getting, let's say the person is somebody who's not quite bedbound, but they really cannot get out of bed without the assistance of somebody helping them transfer into their wheelchair, and then they're kind of mobile in their wheelchair, but they need the transfer then again to their comfy recliner. So that's another example. And then toileting. Some people can get themselves to the toilet, but then even with the assistance of a toilet chair may not be able to get themselves up or have hygiene issues related to toileting, and the personal service, the personal care person can help with that service.
And I will mention again, this really does vary by state, and I believe there's 26 states now that have some type of licensure for the more on the non-medical side of caregiving, where they very clearly define what can and cannot be done in terms of someone that has to be licensed, or whether it's companion care or personal care. So I would recommend that someone check those things in their state. I think that'd be the safest way to do it. The next thing I want you to talk about is nursing care, because sometimes nursing care can also be paid for privately, and other times it is only available through a Medicare certified agency.
And I know a lot about several states, Marilee, but I do not know about all states. But there is a licensure, for example, since I'm someone from the state of Texas, there's a licensure here in Texas we call the private home health license, and a person does not have to be Medicare certified to do these nursing services. And it includes an assessment. It does include all these more complicated things, and it really is significant. We had a client who was dying of brain cancer, and she wanted very much to live the rest of her life in her own home. And we were able to hire for her nursing skilled care. And so all of the things as she went on the journey, they were able to help her with. And so I think that's really important. The cost of nursing care is obviously, nursing skilled care is going to be a little more than obviously companion care or personal care, but also may not be needed for the longer blocks of time. It might be that you have someone who comes in for nursing care for 2 or 3 hours a day, and the rest of the day could be handled by somebody doing personal care.
Now, we've talked about lots of different types of things, so now let's get down to criteria for selecting a provider.
I think it's really important that, I think it's just wonderful that people have signed up to listen to this webinar, and that maybe other people will have an opportunity to listen to it even if they couldn't be with us at this particular time, because asking the right questions and looking at what you really want is very significant. So we've talked about looking at the levels of care provided by the agency and the type of agency. So you need to know whether you're really wanting companion and homemaker care, personal care, or skilled care. And you want to ask the agency, do they have these things, or do they have, maybe only one level of it? Maybe you need 2 levels of it. You need to just talk to the agency and understand those distinctions and know what you want. And then obviously you need to think about, well, do I want a registry, which is generally an independent contractor, or do I want employed staff? Do I want someone who's licensed or someone who is unlicensed? And if you're perfectly happy employing the staff, and I worked with a daughter one time who said, that's what I want to do. I want to employ the staff, and I want to manage them. This is my daddy, and I'm retired, and this is what I want to do. And she was remarkably successful at it. She then wanted, in addition that, to hire some people to be a companion. I found that very interesting. So she had the employed staff doing personal care, and then she hired somebody from an agency to do companion care, and she kept the lines separate. So it's very interesting. People can do any number of combinations of things. If you're dealing with a licensed agency, know there are some limitations. For example, with a licensed agency, many of them cannot dispense medication, but sometimes an unlicensed private hire can in fact dispense medication. So knowing what the rules are, asking good questions are really very important.
Now, if you were going to try to tell someone what's the best way and what criteria they should use to select a provider, what are some of the things that you need to look for?
I think whether you're hiring someone yourself or actually using an agency, I think you should be aware of important pieces up front. Credential checking is very important. So doing criminal background checks, checking to see if they say they're an LVN or which is a licensed vocational nurse, if they say that they have other kinds of credentials, then you want to check that out. You also want to do reference checking. You may want to do competency testing, and there is a lot of competency testing programs out there for agencies to use, and there are some for individuals to use. So checking with really their ability to work with somebody who has dementia. Do they really know if your person has a Hoyer lift that needs to be used? Do they have the competencies to do that? They may tell you they're a wonderful cook, but pin it down. What kinds of foods will they be preparing for your loved one? You want to see if there's been any kind of state abuse, and each state tracks registries of abuse and reporting of that. And then you want to find out what are their ongoing, their orientation procedures and what are ongoing procedures. And if you decide to hire somebody, then you want to take a look at how am I going to do this? How am I going to orient this person? I don't want to just hire the person, have them show up and meet my loved one and then leave, allowing both my loved one, my senior or my disabled person in my family to then do all the orientation. So how are you going to do the orientation, and how are you going to keep up with ongoing training needs as the person's health conditions may deteriorate?
I'm going to, instead of going to the next slide, we have a question that's come in, and I think it really would help to address that question now, because it's a really good one in terms of the different types of care. If someone needs personal care and skilled nursing care, the question is, can the different types of care, the personal care and the skilled nursing care, be scheduled at different times of the day, because someone may not need a skilled person for several hours at a time. And you had talked about that, but because a lot of people don't really understand home care, how would someone do that?
Well, I think one of the things that what you would do is look at what are the nursing issues that you have. Sometimes an easy way to do it is if you had an agency that provided both nursing and personal care, and they could probably easily work with you. But let's say we were looking at medication setup and maybe catheter care. And so maybe what could happen, or I can go back to my own individual client, she really needed somebody. She slept late. She needed somebody from 10 to 12 to make sure that these medications that she needed were available if they needed to be crushed. The skilled nursing person could crush the meds for her ability to swallow. They could check on some other things. And then she had another regular personal assistance person there who was there from 8 to 10 and then from 12 to 6, and then somebody else who spent the night. So knowing your needs and then working with the agency, generally there are most personal assistance services as well as companion and homemaker services, if you're actually dealing with an agency, have some minimums. And those minimums generally are 3 or 4 hours that they will charge you at a regular rate. If it's higher than that, if there are fewer hours than that, the rate is usually higher. Nursing frequently is done in 1 hour, 2 hour, 3 hour segments.
We do have an attendee also who doesn't feel we're strong enough on letting people know about the liability issues from hiring privately. And since we've got the procedures used for hiring care staff, and these are the things that an agency would do you want to talk a bit about liability issues of hiring someone privately that you, and even, I mean, if you haven't done these checks, or if they don't have anyone to monitor and supervise them and provide backup care?
Well, I know some, obviously, about it, but what I would say is, I lots of times folks tell me, oh, my home policy will take care of if they have a fall in the house or any of those kinds of things. And certainly if you're going to privately hire someone to provide services in your house, you really do want to see what coverage would happen from either a theft or a fall by the caregiver, or what happens if the caregiver drops your loved one. What are the liabilities involved in all of that? So going to check on your home care policies is really important. I would say the sad situation is that lots of times one of the people don't think about bringing folks into their home and don't take the precautions they should. You're in a hurry, you need to get some help from mama, you need to go back to work, and so a friend tells you that Mrs. Smith down the way used caregiver Sally, and so you just hire her immediately. You've done none of the background checks or the reference checks or the competency checks, and yet you have put them in a huge area of responsibility, and there is theft in this area, and I think people need to be particularly careful that they protect both themselves and protect the caregiver. I'd say 98% of caregivers really want to do a good job and they don't want to steal anything. But if you've got a person in the house that has dementia and can't find anything, then the next thing you see is they're pointing to the caregiver. So you need to make sure that you have things inventoried and that you have things put away. You don't need a lot of cash in the house, all those kinds of things. Whereas if you have an agency, agencies will generally coach you about what things to do in order to protect yourself, and then a part of it is because they have liability for a lot of things. So I hope that answered the question.
Good, thank you. Now, sort of a wrap-up for the topic. So this is really things that you had talked to us about that we thought were important for the audience attending tonight to hear.
Well, I think I'm so excited that people chose to listen to this and to get a better understanding of what the options are of home care. And I want to just reiterate again, I think home care is just one of the greatest gifts to families, in the sense that it can give the individual a purpose, that it can give the person an opportunity to continue to participate in life, some independence. I think most of us do not want to be dependent on our families, so having someone that can help us still explore the world and enjoy life is wonderful. But the very first step in doing that is the selection of the caregiver. And I think you've got early on to sit down and take a look at what kind of services do I want, what kind of care is needed, and then it's really important to select the right kind of person. Begin to identify what would be the right person to work in a household. And things like, should the person be talkative, not very talkative? Would it be better to have the person be younger? Would it be better to have the person have certain physical interest? Maybe the person needs to be a great bridge player. Maybe they love to do exercise, any number of kinds of things, so that picking the best person, the language we've used here is a soft match. So the agency and or you, if you're doing the hiring, would do the very best we can to match that person up. The advantage of using an agency is that match may not be perfect the first or second time, and so you can fine-tune it to get the right person. I know a lot of families to me say, well, if I ask mom who she wants, she'll just say, well, anybody will do, when in fact that isn't true. And so thinking through who would be a good person to spend quality time with your parent or family member or loved one would be a valuable thing. The second is think through how you're going to monitor this. Agencies have requirements, but once it gets started, they may keep a log of what the person does while they're at your house. But how are you going to know if your parent's really being well taken care of, and how are you going to know if the agency's really doing what they said they would do? So thinking through monitoring How's that really going to happen? Are you going to go over there and look at the log and provide feedback to the agency? Are you going to look at the log and provide feedback to the caregiver? Are you going to ask for more information on the log? I realize I'm throwing out a lot of things, but I think so many times we have failures because people spent so much time in the upfront decision-making part, and then where the rubber meets the road is really in the ongoing care part. So communication, how are you going to communicate with the caregiver, the agency? How are you going to communicate with your family member who's getting the care? And how do we keep that at a level that really is professional and works well for everybody? And of course the last part is evaluating. That's all part of this monitoring process. How's the care going? Is the caregiver appropriate in caring? There are lots of different ways this can be done. I mean, different family members can participate in that, but I think thinking through not only what do I want in a caregiver, what are the needs, what kind of agency do I want to hire independently, but then more, as equally as important for the long haul, is to make sure that you get the right caregiver and that you monitor and communicate and evaluate through the process.
I've got a couple more questions here that that have come in, and one of them is, what's the best way to introduce a companion homemaker to someone's parents?
So that's a good question, and I guess maybe I would want to ask a few others in advance of that. Hopefully you'd be able in some way, shape, or form to have involved the parent in knowing that they were going to have a companion. And I think having just open-ended conversations with the parent to say, as an example, you know, have you ever thought about the possibility of falling? And what would you do if that happened? And how could you deal with it? And what if it happened in the bathroom? And just start having these kinds of open-ended conversations, and then involving the parent in deciding what kind of companion would be the kind of person, or what activities would they like to do. And then I suggest going and introducing the folks, hanging around for a little while, and then maybe giving them an activity to do together that begins the relationship.
Very good question. I have another one in here about live-in care. Can you talk a little bit about live-in care? And this, again, may vary based on wage and hour laws state to state. So
it does vary a lot, I think, Marilee. But live-in care is very interesting because, again, I think you have to think about that becomes then a 24-hour job. And so one of the considerations would be, if you're having live-in care, is the person going to be able to get roughly 8 hours of sleep at night? And because that's really important. You can't have 24-hour care from one person if they're not able to get adequate rest. So you need to take a look at that. If your person is an Alzheimer's person who gets up and wanders most of the night, live-in care might not be ideal, or you may have to have two people work the 24-hour shift in order to get that worked out. Another thing about live-in care is 7 days a week, 24 hours a day, people will burn out. They will have personal crises. So how do you work that out? So sometimes having a live-in is a fabulous thing because the relationship really can develop between the person receiving the care and the caregiver. As an example, we have a client, an elderly gentleman that was hurt in an industrial accident, and he does not have dementia, but he gives the appearance of having dementia. And so he owned his own home, and with much effort, it was found a single parent who has a son who's in high school, and she is his live-in caregiver. And it has been the most lovely experience because the older man really enjoys having the he was a junior high now, teenager boy in the house, because they'll pitch the football and they'll talk sports and they like watching games together and that kind of thing. And also at the same time, the live-in has involved her family. So when they go to Thanksgiving dinner, she takes the senior client with her to Thanksgiving dinner. Those are rare, but those sets of circumstances happen. So you've just got to evaluate again. So much of this is so personal. You, again, like I said early on, you have to look at your personal choices, the finances, what's available, a lot of things like that.
I've got some other very specific questions, but I think we'll answer those offline because they're very specific, and so we will definitely do that. So those of you who've asked those questions know that we'll get back to you. I think one other question about live-ins, and the question was, I think there is confusion about what a live-in is. A cost question, and I don't think we can answer cost questions because that really does vary. But the other question was, do live-in workers travel in and out of the state with a client?
I have certainly known a live-in, but the live-in client that I'm thinking of that traveled in and out of the state actually was, as we described earlier, was not an agency hire, but a private hire. And this lady had houses in several locations and family, and she was still able to travel. In fact, this live-in caregiver went on a cruise with her. So again, I think you'd have to look, if it's an agency hire, you want to take a look at the agency rules and regulations by state, and if it's a private one, I think you want to look and see whether that just really has workability or not.
Yeah, I was going to say, I don't think there's any blanket answer for some of these questions. So, well, we are out of questions except for the couple we'll handle offline privately, and we have, for more information, we have a couple of places we're here. Caring.com has an incredible amount of helpful resources on their site, and we're going to post some of these tomorrow on the Help Choose Home website. And pdhca.org, I had a question about what does that stand for. That's the Private Duty Home Care Association, and that's a sort of a funny name, but private duty, the name of this came from many, many years ago when people would be in the hospital and they'd have a nurse on the floor, and they knew they needed help at home when they left the hospital, and they would say to that nurse, "Can you do some private duty with me?" And that's really how the name started. And for those of us within the industry, it has stuck. So again, I want to thank you very much all for attending. We have our very next webinar, October the 11th, and that will be Signs That Home Care is Needed. And we are partnering in that webinar with Leading Age, and we will look forward to having some of you back again. And if you have any questions, please utilize some of our resources for that. Mary Kofand, thank you so much for your time tonight. It was invaluable. And audience, thank you so much for attending. And this webinar will be posted on our Help Choose Home website tomorrow morning. So everyone have a great evening. And thank you again, everyone, for attending and for presenting, Mary.
Thank you.